If you are over 70 years old and you have ever walked into a room and forgotten why you went there, you need to listen to this. Seriously, pay attention. We all have those little moments. Where did I put my keys? What was I about to say? And we laugh it off and call it a senior moment. But what if I told you that for millions of older Americans, those moments are not just normal aging? What if they are the first whispers of something much more serious? A major study published in the journal Nature Neuroscience followed more than 12,000 older adults for 10 years, and what they found is both frightening and hopeful. The seniors who experienced frequent memory lapses had a much higher risk of developing dementia later in life. But here's the good news. The study also found that early intervention can slow this process down by up to 40%. I am Dr. Xyal M. Rubo. In the next few minutes, I am going to reveal the difference between normal age-related forgetfulness and the early warning signs of dementia. I will explain the 3 types of memory loss and which ones are dangerous. And I will teach you a simple test you can do at home tonight that can tell you if your memory is on the right track. This information could genuinely save your mind. Before we go any further, drop a comment right now with just your age. If you are 72, type 72. If you are 78, type 78. If you are 83, type 83. I want to see who is listening. And if you have ever forgotten something important recently, add the word forget to your comment. You will understand why in just a moment. Let me start with a story that plays out in millions of American homes every single day. Margaret is 74 years old. She is sharp, independent, still drives herself to the grocery store. But lately, she has noticed something strange. She will be in the middle of a conversation and suddenly lose her train of thought. She will put the milk in the cabinet and the cereal in the fridge. She jokes about it with her son, Robert. Just another senior moment, she says. But last week, she went to the store and could not remember how to get home. She drove around for 20 minutes before recognizing a street. That night, her son Robert came over and they had a long talk. Margaret is now in the early stages of Alzheimer's disease, and her family wishes they had known the signs sooner. According to the Alzheimer's Association, more than 6 million Americans over 65 are living with dementia, and millions more are in the early stages without even knowing it. The scariest part? Most of them dismiss the symptoms as just getting older. So let me explain the difference. And I want you to listen carefully because this could be the most important health information you hear all year. There are 3 types of memory loss associated with aging, and only one of them is dangerous. The first type is called benign senescent forgetfulness. This is normal aging. You forget where you put your keys. You forget someone's name temporarily. You walk into a room and forget why you are there, but then it comes back to you a few minutes later. According to Johns Hopkins Medicine, this affects nearly 40% of older adults and is completely harmless. Your brain is simply processing information more slowly, but the information is still there. The second type is called mild cognitive impairment. This is the gray area between normal aging and dementia. You forget appointments. You have trouble following conversations. You lose your train of thought more frequently. According to the Mayo Clinic, about 15 to 20% of people over 65 have mild cognitive impairment. And here is what you need to know. Not everyone with mild cognitive impairment develops dementia, but the risk is higher. The good news is that this stage is reversible for some people with the right interventions. The third type is dementia. This is not normal aging. This is a disease. Dementia means your memory problems are severe enough to interfere with your daily life. You forget how to do tasks you have done for years. You get lost in familiar places. You repeat yourself constantly. You may forget the names of close family members. According to Harvard Medical School, dementia is caused by physical changes in the brain, including the buildup of proteins that damage brain cells. So how do you know which category you fall into? Researchers at the University of California, San Francisco have developed a simple self-assessment that can help identify early warning signs. Let me walk you through it. Ask yourself these 4 questions. Be honest. 1. Do you have trouble remembering recent events or conversations more often than you used to? 2. Do you have difficulty finding the right words in a conversation, more than just occasionally? 3. Have people close to you commented that you seem more forgetful lately? 4. Do you have trouble keeping track of your finances, like paying bills or balancing your checkbook? According to the UCSF Memory and Aging Center, if you answered yes to 2 or more of these questions, it does not mean you have dementia, but it does mean you should pay attention and possibly speak with your doctor. Now let me explain what happens in the brain when memory starts to fail. Stanford University neuroscientists have identified 3 key changes that occur in the aging brain. First, the hippocampus shrinks. The hippocampus is the part of your brain responsible for forming new memories. Think of it as your brain's librarian, filing away new information so you can find it later. According to Stanford Medicine, after age 60, the hippocampus can shrink by 1 to 2% each year in people with memory problems. This is why learning new things becomes harder as we age. Second, blood flow to the brain decreases. Your brain needs constant oxygen and nutrients to function properly. According to the American Heart Association, the same plaque that builds up in your heart arteries can also build up in the tiny blood vessels in your brain. When blood flow is reduced, brain cells starve and die. This is why high blood pressure and high cholesterol are linked to higher dementia risk. Third, abnormal proteins build up. In Alzheimer's disease, 2 proteins called beta amyloid and tau start accumulating in the brain. They form clumps that interfere with communication between brain cells. According to Massachusetts General Hospital, these protein deposits can begin forming 10 to 20 years before any memory symptoms appear. Now, here is something most people do not know. There is a simple test you can do at home tonight that can give you a clue about your brain health. It is called the clock drawing test. Here is how it works. Take a piece of paper and a pen. Draw a clock face. Put all the numbers in the correct positions. Now draw the hands to show 10 minutes past 11, which is 11:10. That sounds simple, right? But according to Weill Cornell Medicine, this test is incredibly powerful. People with early dementia often make specific mistakes. They might put all the numbers on one side of the clock. They might leave out numbers. They might draw the hands pointing to the wrong time. This test assesses multiple brain functions at once. Your brain has to remember what a clock looks like. It has to plan where to place the numbers. It has to understand time and translate that into hand positions. If you struggle with this test, it is worth mentioning to your doctor. Now let me talk about the factors that increase your risk of dementia, because knowing these can help you take action. According to the Lancet Commission on Dementia Prevention, there are 12 modifiable risk factors that account for 40% of dementia cases worldwide. Let me share the most important ones. High blood pressure. According to Johns Hopkins Bloomberg School of Public Health, untreated high blood pressure in midlife increases dementia risk by 60%. Your brain needs steady blood flow to stay healthy. Hearing loss. This surprised me too. According to University College London, older adults with untreated hearing loss have a significantly higher risk of dementia. The theory is that when you cannot hear well, your brain has to work harder to process sound, leaving less energy for memory and thinking. Also, people with hearing loss often become socially isolated, and social connection is crucial for brain health. Smoking. According to the Centers for Disease Control and Prevention, smokers have a much higher risk of developing dementia. The toxins in cigarette smoke damage blood vessels throughout your body, including in your brain. Diabetes. According to the American Diabetes Association, people with type 2 diabetes have a significantly higher risk of Alzheimer's disease. High blood sugar can damage blood vessels and nerves throughout your body, including your brain. Physical inactivity. According to Harvard T.H. Chan School of Public Health, regular exercise is one of the most powerful things you can do to protect your brain. Exercise increases blood flow to the brain and stimulates the release of chemicals that help brain cells survive. Poor sleep. According to University of California, Berkeley, during deep sleep, your brain actually clears out toxic proteins that build up during the day. If you are not getting enough quality sleep, those proteins can accumulate and damage brain cells. Social isolation. According to Florida State University, older adults with strong social connections have a much lower risk of cognitive decline. Talking with others keeps your brain engaged and active. Now let me give you specific numbers. What should your blood pressure be to protect your brain? According to the American Academy of Neurology, keeping your systolic blood pressure below 140 is important, ideally between 125 and 135 for most older adults. What about cholesterol? According to Cleveland Clinic, total cholesterol should be below 200, and LDL, the bad cholesterol, should be below 100. What about blood sugar? According to the Endocrine Society, a fasting blood sugar below 100 is ideal. Below 110 is acceptable. Above 125 indicates diabetes, which indicates dementia risk. Now let me talk about something that gives me hope. Your brain is capable of change at any age. This is called neuroplasticity. According to Columbia University, you can grow new brain cells and form new connections throughout your life. The key is giving your brain the right stimulation. Let me give you 5 science-backed strategies to protect your memory. First, physical exercise. According to University of British Columbia, aerobic exercise that gets your heart pumping increases the size of the hippocampus. That is the memory center we talked about earlier. Aim for 150 minutes of moderate exercise per week. Brisk walking, swimming, dancing, anything that raises your heart rate. Second, mental stimulation. According to Alzheimer's Research UK, learning new skills is more effective than doing crossword puzzles. Why? Because crossword puzzles use skills you already have. Learning something new, like a language, a musical instrument, or how to use a new technology, forces your brain to build new connections. Third, diet. According to Rush University Medical Center, the MIND diet, which combines the Mediterranean diet and the DASH diet, can reduce Alzheimer's risk significantly. This diet emphasizes green leafy vegetables, berries, nuts, whole grains, fish, and poultry. It limits red meat, butter, cheese, and sweets. Fourth, social connection. According to University of Michigan, people who stay socially engaged have better cognitive function. Join a club, volunteer, call a friend, go to community events. Isolation is bad for your brain. Fifth, sleep. According to the National Institute on Aging, adults over 65 need 7 to 8 hours of sleep per night. During deep sleep, your brain clears out toxins. If you have sleep apnea, get it treated. Untreated sleep apnea starves your brain of oxygen and increases dementia risk. Now let me talk about supplements because I know many of you are wondering about them. The supplement industry makes billions of dollars selling memory pills. But what does the evidence say? According to the National Institutes of Health, there is no strong evidence that any supplement prevents dementia. Not ginkgo biloba, not omega-3s, though they are good for heart health. Not vitamin E. The only supplement that may help is vitamin B12 if you are deficient and vitamin D if you have low levels. But get your levels checked before taking anything. Here is what concerns me. Many people spend hundreds of dollars on supplements that do nothing, while ignoring the things that actually work. Exercise, diet, social connection, sleep. These are free, and they are more powerful than any pill. Let me give you specific action steps you can take starting tonight. First, if you are over 70, have a conversation with your doctor about your memory. Do not wait until there is a problem. Ask for a baseline cognitive assessment. Many doctors do not do this routinely, so you may need to ask. Second, do the clock drawing test I described earlier. If you struggle with it, bring the results to your doctor. Third, get your numbers checked. Blood pressure, cholesterol, blood sugar. Knowing these numbers is the first step to managing them. Fourth, if you have hearing loss, get hearing aids. According to Johns Hopkins, treating hearing loss is one of the most powerful things you can do to reduce dementia risk. And yet, most people with hearing loss do not use hearing aids. Fifth, if you smoke, quit. If you drink heavily, cut back. According to the National Institute on Alcohol Abuse and Alcoholism, heavy drinking in midlife significantly increases dementia risk. Sixth, Stay socially connected. If you live alone, make an effort to see people regularly. Join a group, volunteer, call family members. 7th, challenge your brain. Learn something new. Not the same crossword puzzle you have been doing for years. Something genuinely new and difficult. Here is what you now know that most people do not. Forgetting where you put your keys is normal. Forgetting what keys are for is not. Occasional word-finding difficulty is normal. Forgetting the names of close family members is not. Getting lost in a new place can happen to anyone. Getting lost in your own neighborhood is a red flag. According to the Alzheimer's Association, 75% of people with dementia worldwide are never diagnosed. Think about that. Millions of people are struggling with memory problems, thinking it is just aging, when early intervention could make a difference. There is no cure for most dementias, but there is a lot you can do to slow progression and maintain quality of life. And the earlier you start, the better. If this information gave you clarity, if it answered questions you have been wondering about, if it gave you confidence to talk to your doctor about your memory, then I have done my job. Drop a comment right now saying informed. Share this audio with friends or family members over 70 who might benefit from this information. You could be the one who helps someone get the care they need. Subscribe to this channel because my mission is bringing you research-based health information that is accessible, practical, and potentially life-changing. In my next audio, I am going to talk about the 3 exercises that research shows are most effective for preventing falls in older adults. You are going to want to hear that because falls are the leading cause of injury in people over 65.